Mazur. I'm on the joint appointment between SILS and School of Medicine, and I'm excited that the last year I've been able to be here and really learn from you guys and really hopefully start contributing to the department. So what do? Before I start, I have to say I just came back from a Lean Six Sigma conference where I was giving a keynote talk, but I had to go after a CEO from Porsche. And that was difficult, but it's hard to follow Porsche, right? And then today, again, I feel exactly the same way. So it's right there. But what I do, I'm an industrial engineer, so I'm boring. Engineers are kind of boring. And we kind of do things very structurally. But my interest is to remind myself what I do in the research, and I usually put that in my talks. I have a picture in my slides, when I put the picture of my kids. Right, so I have a Sebastian and Alexander, almost 11 and 5. And then on the same slide, I put a picture of the hospital and of the airplane. Right? And what I say is that when I think about my kids and putting them on the airplane versus getting them to the hospital for the simplest procedure, I'm more nervous and more anxiety about them going to the hospital than putting them on the flight. And that reminds me all the time about what I'm trying to do with the work every day in my research. So I work on patient safety and continuous quality improvement. Right now, currently, there are a lot of emphasis on the patient safety is what is happening with provider interaction with electronic medical records. Most of them spend 80% or more time in front of the computers typing, documenting, and really very little time spending with the patients. A lot of errors happen during these interactions that leads to patient harm. And there's another effect of providers burning out. They don't want to be working like this. So a huge initiative right now in the healthcare system is that there's prevention, the wellness idea. So those are the things that I'm very much interested in, and I like to use engineering approaches to help and figure out how to redesign the systems, right? So I teach systems analysis class, and I bring a lot of kind of my healthcare expertise and really examples to think about how systems operate and interact together. Within that component of safety, I try to also look at the human being and the safety mindfulness, right? So I kind of think when you interact with any system, and one little decision in the process of reading all the documentation, the past history, the medication reconciliation processes, one moment somewhere there can lead to a disaster, right? Someone getting the harm and dying because of that mistake. So there is that aspect of a cognitive moment that I like to call safety mindfulness that has to trigger, and people have to have some understanding about the risk. So how do we enhance that? How do I enhance the risk and thinking about the risk? I do this through simulation-based training, right? We try to kind of simulate in the laboratory scenarios, put people through some easy scenarios, more complex scenarios, and then because they do make errors, you have a nice debriefing moment with them, and you try to enhance their moment of thinking about safety, right? So we do a lot of with simulation-based training. On the continuous quality improvement side, I'm mostly interested in Lean and Six Sigma things. So Lean is an improvement methodology that came from Toyota and became famous across the world in different industries. And I like to study when Lean gets implemented in healthcare, what leads to successes or what leads to failures, what are the barriers of the implementation. So I look at the implementation process itself.